This is Nadir Shah in Chicago, and you are watching my channel, Knowledge for Quality of Life. Friends, I have talked on many various topics over the last 2.5 years. And one health condition which comes to my mind, and recently I came across a paper. Um, I wanted to bring it to your attention on that issue, which we hear a lot about in healthcare organizations and medical community, including my community as well, is mental health. Now, if I were to tell you that there is one nutrient which no one is talking about, which is the basic premise of mental health, besides many other things which we hear. It's mind-boggling, and I want to highlight some salient features of that paper or that article which I read and bring it out to your attention. So people who are dealing with these issues, make sure that you don't overlook this nutrient. And this nutrient is no other than my favorite is vitamin D. Now, this nutrient, which is a pro-hormone, has changed my, healthcare completely. Not only myself, but my family members as well. And I can vouch, based on the three levels of, understanding I've gone through. First is I heard it, I digged it up, I researched it throughout, and I implemented by adopting this. And for the last 8, 9 years, my health is been amazing. Even though I have had many issues in the past before when I was vitamin D deficient, not anymore. I don't experience anything at all. So before I get into the topic, I welcome all those who have recently joined the channel. And if you have any concerns, questions, comments, please include into the comment section for that particular vlog, any previous vlogs which I have talked about, and I'll try to respond in a timely manner. So let me share my screen with you. So what you see here, this is a study done for U.S. veterans, and it's a very comprehensive study, including 169,241 veterans treated with D2, and 490,885 treated with D3. So what they found, this is the background and context. Let's say vitamin D cuts suicide and self-harm risk nearly in half among U.S. veterans. Background and context, it is estimated that 30 to 50% of the US veterans and service members have D levels below the 20 nanograms per milliliter, or which is equivalent to 50 nanomoles per liter. Now, I have talked about it in many of my previous vlogs that, 1 nanogram per milliliter equals to 2.5 nanomoles per liter. So basically, those countries where international units are being used, they measure vitamin D level in nanomoles per liter, which is, in this case, a 50. So 20 is it's like a very low level. Below 20, they have found, 30 to 50%, means half of the population of US veterans were below the bare minimum, which prevents somebody from a bone disease, which we know as, rickets. So the cited study included these many people with D2 and these many people with D3, as I said. Now, remember that, from my previous vlog, D2 is a plant-based, it's called 𝗥𝗏𝗁𝗔, and this thing is an animal source vitamin D3. And we will talk about it, and I have mentioned before that, D3 is more potent and effective than D2. So when somebody is severely deficient in D, and you go to see a doctor and doctor gives you a green capsule, gel cap type of thing, that's based on D2 formulation, because D3 is animal source and it's over the counter, so they cannot make any money and they have to prescribe you a D2. But D3 is more effective and potent than D2, which we will see in this study as well. Suicide is a multifactorial issue. nutrients are one modifiable factor alongside of psychological, social, and clinical interventions. Of course, we know that. I'm not saying that, vitamin D is a silver bullet for mental health, but, it's a basic premise. So key findings, what they have found in key findings of this study, vitamin D supplementation was associated with a 45% lower risk of suicide attempts and self-harm for those using D3 and 48% lower risk for those using D2. And we will look into the chart below on the next sheet as well. So among veterans, baseline D was 0 to 19. Of course, as we said before, it was below 20 nanograms per milliliter. Supplementation with D3 showed 64.1% risk reduction compared to non-supplemented peer, means compared to controls. A dose-dependent relationship was observed as well. So each additional 1% increase in average daily dose among low-level individuals correlated in 13.8% drop in the risk. Now, by no means I'm saying that you have to gobble vitamin D. No, as I said in my previous numerous vlogs, that level matters. You can have a very low dose and make a good level, or you are taking a lot of vitamin D and not making any level. It all depends on individual, and make sure that you see my previous vlogs. I have done many vlogs on this issue than any vloggers you can imagine, because this is my passion about this potent nutrient, and I've been studying this thing for last 8 to 9 years, and I can tell you anything if you want to understand about this potent nutrient, which is a prohormone. So a dose-dependent study was observed as well. The magnitude of risk reduction varied by race. Remember that, they have looked at Black veterans, Afro-American veterans, and white veterans. So there's a greater reduction in the risk in Black veterans versus white veterans. Reason? Because the color of the skin people are more prone to have a D deficiency, because, as I said in my previous vlogs, that skin pigmentation matters, because darker color skin people are at more risk. And if you are at more risk, you're going to see a better risk reduction when you supplement with vitamin D. Okay. So this is the pictorial form. So let me explain this thing. This is a risk reduction of suicide and self-harm on the y-axis. And on x-axis, they have categorized prescribed vitamin D2 here and prescribed vitamin D3 here. So they have looked at Black veterans here, and they have looked at white veterans here. Similarly, Black veterans and white veterans. So in D2, so if the control was people who are not given any supplementation, they were at, let's say, hazard ratio or risk of 1.0. When they were treated in category of Black veterans, they were treated with vitamin D2. There is a 58% risk reduction. Okay. And white veterans, there was 46% risk reduction. Now, greater risk reduction was observed because they were, severely deficient to begin with. So that's how you see the advantage. Now here on D3, the risk reduction for Black veterans was 64%. As I said earlier, that D3 is more effective than D2. And you can see the note here as well from the researcher who did the study. And note says that vitamin D2 is a synthetic non-human product derived from plant precursor. Basically, they use from the mushrooms. They extract the D2, which is stored in the mushrooms, and they have a plant formulation, and is not utilized by the body as efficiently as D3. So there is an issue of effective utilization by the human body. D3 is more effectively utilized than D2. That's why D3 is more potent and effective. So that's why here a researcher is saying that, some supplementation with vitamin D3 is recommended, not with D2. And you see that, here with D3 in white veterans, the risk reduction is 39%. Now, what is the rationale behind it? What is it, a magic? No, it's not a magic. There's a biological rationale behind it. One has to understand, because, as I said in my previous vlog, that each and every cell in our body, human body, at various cellular levels, the nature has embedded a chip which we call vitamin D receptors. And of course, brain has that vitamin D receptors at various levels as well. So here they are saying that in these vitamin D receptors crave for vitamin D in the hormone form. When the vitamin D which we consume either through pill or we get from sunlight, which is inactive, and then once it gets activated and gets processed through the kidney, it becomes the hormone, which is 1,25-dihydroxy, which we call calcitriol. That hormone provides all the raw material at various cellular level through the VDRs, because those VDRs are always craving for those vitamin D, in the hormone form for the proper functionality of those, at the cellular level. So vitamin D receptors, VDRs, are in the brain region implicated in mood, cognition, and stress regulation. Example, hippocampus, hypothalamus. These are various parts of the human brain. Now, this paper is, I'm going to be including in the description as well. It's coming from Grassroots Health Net, so you can read in detail as well. So this is a current knowledge, okay? Higher vitamin D level is in brain tissue have been associated with better cognitive function, slower cognitive decline, and improved memory in postpartum analysis. Other nutrients and consideration, the article also mentions magnesium, zinc, omega-3 fatty acids, which I have mentioned in my vlog when I did omega-3 and magnesium and other potent nutrient, which works as a cofactor with the vitamin D. So make sure that you spend some time, in educating yourself. The key is education, okay? Supportive for mental health and reduction of depression risk. So all these mental health issues like depression, seasonal affective disorder, all these things are attributed to vitamin D deficiency as well, as a potent nutrient. Because you have to provide the basic layout of the foundation first and then build on other factors as well. A large synthesis found omega-3, especially EPA, supplementation reduces symptoms of major depressive disorder beyond what is seen in antidepressant alone. Now, remember that, as I said in one of the previous vlog, that brain is nothing but blob of fat. Now, it thrives on fat, okay? It needs fat. Now, D is not only fat soluble, but, it thrives on omega-3 as well. So omega-3 fatty acids, which is, in salmon or mackerel or oily fishes, you have to consume that, because that's the prime source of omega-3. I don't only consume wild-caught salmon, which is a sockeye, twice a week, but I supplement myself with krill oil as well, 1,000 milligrams. So I try to maintain my omega-3 fatty acids in my blood at least 8%. The range is 8 to 12. So I make sure that me and my wife both are at least 8% or above. Implication and recommendations. Measuring baseline D level, vitamin D and other nutrients level is recommended to identify deficiency and guide supplementation. So make sure that you create your baseline. I have done many vlogs. I have even done vlog on how to customize individual vitamin D protocol, which I did, and I showed it to you, that how one can do it, because we are all individually different. We have to calibrate our own dosage because we metabolize differently. For those deficient, target supplementation, especially with D3, may yield stronger protective effect on suicide and self-harm risk. Now, this thing is very common. Suicide is, amongst teenagers and people at the adolescent age. So make sure that, your kids, your loved ones, whoever you are familiar with, they are adequate on the base requirement of optimum level, between 40 and 60 at least. I personally like to keep between 60 and 80, as I have mentioned in my previous vlogs. Please look at those. The regular testing, at least every 3 to 6 months, is advised to assess whether the target ranges are achieved and maintained. That's a very crucial thing, because we have to maintain that level throughout the year, because if you don't keep maintaining that level is going to drop. And guess what? You are at risk because nutrient status is only one piece of the complex picture. Holistic approaches such as mental health support, counseling, social support are essential. Of course, we talked about it. There are many parameters, many variables which are at play. But you have to provide the basic nutrient which the nature has wired for, through VDRs, vitamin D receptors. Let me pause here, stop share here. So you can do many interventions on the side, social connectivity, counseling and everything. But, the basic nutrient which the nature has wired for and VDRs are present at your brain level and at various cellular level. If you are depriving that main raw material for that functionality, of course, the results are not going to come. It's like basic bread and butter, which the human body is looking for. Okay, so make sure that this important concept, this important issue of vitamin D optimization in one's health for the quality of life we are talking about is so much important that I don't have words that I can attach to it. Okay, and next week I'll be looking at, because we are coming almost to the close of September, and we are getting, particularly in the colder climate, upper northern hemisphere, we are getting into the cold weather, and it's going to be a flu season. So now people are been advocating, which you are hearing day in and out, about flu vaccine, RSV. COVID is in our bucket list as well. So all these things, and to buy the adaptive immunity. So what are we doing as humans to increase our innate immunity, which nature has provided us? And I'm going to discuss a little bit about it, that how the innate immunity is with you 24/7 for the rest of your life if you take care of it, versus the adaptive immunity. Until next week, see you. Goodbye.